Hi everybody, Chris Kuhlman here, certified hand therapist, and today we're going to talk about hand pain. General overview of some of the causes of hand pain. We're not going to take a deep dive into this. We'll reserve that for other videos that we have when you have a specific diagnosis. But in general, if you're having pain in your hand's not working correctly, it's generally due to one of 5 categories. No pun intended, you got 5 fingers in your hand, it just kind of worked out that way. First is a fracture. Fracture is usually something that doesn't come about over time. It's something from a general incident that happens. You can be struck in the hand with a stick, or a ball can hit it, or you can fall on a hand and take a force this way. Anybody I see that is male, that is from 15 to 25 years of age, and has what they call a boxer's fracture, which is on this side of your hand, first thing I always ask them is, what did you punch? And usually sheepishly they will tell me, well, punched it, hit the stud, and you get a fracture there. So fractures are pretty obvious. They're going to happen in here, maybe down in the metacarpal area, even in the thumb area, and those are immobilized and with a cast, or sometimes those need to be surgically repaired. Second area that is typically affected in the hand that causes pain is in one of the ligaments. Ligaments are soft tissue structures that go from bone to bone. So they hold the bones in place so the tendons and the muscles can move them. So you have them at each joint. You've got ligaments and tendons in there that hold everything in place. And those can end up getting stretched, or they can get torn, strained, sprained, torn. All those good things can happen to a ligament. Typical ones we see in the hand are here at the thumb, on the inside of the thumb, when there's a pressure that comes out this way. This ligament here, called your ulnar collateral ligament, ends up getting disrupted or torn. And that often needs to be surgically repaired. We see it in a lot of basketball players in your PIP joints, that they get a sprain when a ball kind of hits it and jams it. And those are problematic because they don't have a very good blood supply. And so there's no predictable healing time. Fractures we can kind of put up on an x-ray and say that it's going to be 4 weeks, it's going to be 6 weeks, because they have a predictable blood supply. Ligaments don't. So often those times, those linger. Personally, I think I would rather have a fracture because I know it's going to heal and I know the time frame. Ligaments, they can go for 8 weeks, 6 weeks, 6 months sometimes, depending on it. Another area where in the hand is the tendons. In the back of my hand, you can see these structures here. Those are tendons. They go from muscle to the bone. Think of a marionette puppet. A marionette puppet, the strings move the puppet's arms and things. Well, the strings are actually the tendons in the hand. So the muscle contracts, the tendon pulls on it, and it goes ahead and it moves the bone. So what you can have there is you can have a trigger finger where the tendon comes down and it gets stuck and won't go back up. Also, if you cut your hand, if I were to cut right here, I'd cut that tendon, and whatever that's attached to wouldn't work again. Sorry, I used that finger, it's just out of habit. Another place that you can have an issue with your hand is in the nerves. Nerves are the electrical wires in your hands. They form the electricity. They allow the muscles to bend and tell your muscles what to do. They also feel things. So when we put a screw in our hand, we know it's a screw by not even looking at it, but we can tell because it's got sensory nerves in there. So if you have a problem with those, you can obviously have, usually that's numbness and tingling in the hand to some degree. If you disrupt one of those, you can't feel much on that surface and stuff. Fifth place you can usually have a problem is at the intersection of the bones, where the bones meet. You can have arthritis in those bones, so you have an inflammation of the bones, and you typically see that here at the base of your thumb. People have CMC arthritis, so they get pain right in this, kind of follows that crease line right there a lot of times. And they have trouble pinching things, they have trouble gripping things. Every time they go to pinch something, turning a key, that kind of stuff, it hurts, and that gets inflammation and soreness in there. So fractures of the bone, ligaments, tendon, arthritis, nerve, those are all, most injuries you either fall into one of those. Sometimes it can be 4 of those 5 issues that you can have a problem. If you crush your hand in something, you can easily break a bone, you can disrupt a ligament, you can lacerate a tendon, and you can stretch a nerve and have some issues. So no matter what your hand pain is, it probably falls under at least one of those categories, maybe 2, maybe 3, maybe 4, maybe even all 5. So if you're having those types of issues, please feel free to check out my website at helpforthehand.com, or you can email me at jchriskuhlman.com, and we can dive a little deeper. Certainly there'll be more videos and more blogs in those places where they'll go into specific diagnosis. So if you end up having a boxer's fracture, we'll talk a little bit more about there. But I just wanted to put this video out there and let you know that, give you a little bit of information about the general areas that are being affected and why you're having that pain. So again, if you are, or if you know someone who's having this kind of pain, this kind of issue, please make sure you get a hold of me through my email and my contacts and through the website, and I'm happy to talk to you a little bit more and find out a little bit more what's going on and give you some information. Have a great day.